This could be an alternative to drugs or months, even years of therapy. Jay Shadler reports on one woman's odyssey confronting her own fears.
For the first time, I called on my deepest, worst fear, and it scared me. Not too much time will pass before someone comes along and calls me to the hospital or drags me away from society.
Siddhartha Jackson keeps her secrets locked in her diary and her life locked in her room. She suffers from a profound anxiety disorder that has made her a prisoner of her mind.
I was fearing going crazy. I felt that I was sinking in quicksand.
This from a woman who until recently was the picture of exuberant youth. As a sophomore at the University of Massachusetts, Siddhartha studied ballet, worked part-time, and even competed in the Miss Boston competition. But 2 years ago, a series of extremely stressful events changed everything. First, her grandfather, with whom she was very close, died. A leg injury forced her to stop dancing. And finally, an intense personal relationship ended bitterly with an unwanted pregnancy. Then, without warning, while waiting to board a subway, she suffered her first panic attack.
And I was just getting at the threshold of the train. I'm feeling hot, I'm feeling sweaty, trembling. I'm definitely, literally trembling. And the woman's like, you know, in the middle of the train, you gotta get on. And I'm starting to shake, and it's so intense to me, and I feel like this sense of unrealness. I am so disconnected. I'm feeling that I'm going crazy.
People suffer a sudden, unexpected burst of anxiety that we call panic attacks.
Psychologist David Barlow is director of the Center for Anxiety and Related Disorders at Boston University. He says a number of factors, including heredity, early psychological experiences, and a stress-related chemical imbalance in the brain can make a person vulnerable to panic attacks.
If you have a sense that when bad things happen or unexpected things happen, that they might be dangerous and they might be out of your control, if those things come together and then the stress triggers it off, then you can have a panic attack and develop a very serious disorder.
Just a week after Siddhartha's panic attack in the subway, a second panic attack. This time while she was driving this stretch of road in Boston.
I'm in the car, and I get this hot flash. And then I get this, like, tingly, racy feeling, like I gotta get out. I can't drive this car anymore, you know, because it's too much responsibility. But in my head, it's like racing and racing and racing and racing.
As frightening as a panic attack can be, it can sometimes lead to an even more extreme condition called panic disorder with agoraphobia. That's what happened to Siddhartha Jackson. Once she suffered those first panic attacks, she became so fearful that she might have another one and lose control. She started avoiding every situation that might put her at risk. As a result, Siddhartha began withdrawing from the world, retreating to the only place she felt safe, her home.
I try to talk with her and ask her what's going on. To me, it was shocking. It's like, what's happened?
Annie McKnight is Siddhartha's mother.
My goodness gracious. Here's a child that, you know, she was an honor roll student in the middle school. You know, she was socially apt. You expected her to matriculate and move on to the world. And then all of a sudden, there's this pulling out the plug. And it's like all electricity is stopped being for her. She's still confined to the house. Now. It's over a year.
During the height of your agoraphobic stage here, could you have gone to a restaurant by yourself?
No.
Shopping mall?
No.
Movie theater?
No.
Taking a walk around the block?
No. No.
Literally, the house was your universe.
Literally my room. It was literally my room.
Finally, with the help of a therapist, Siddhartha took a first tentative step toward recovering from her agoraphobia.
She said, Siddhartha, if you could just get out and sit on your steps, just to get out of the house, to get some fresh air. And every day, just do it a little longer and longer and longer. It took me literally 2 months just to get around the corner from my house.
With the boundaries of her universe now measured in inches and dread, Siddhartha made a critical decision. She asked her mother to take her here, to the Center for Anxiety and Related Disorders, where a new technique is being pioneered to treat panic attacks with agoraphobia.
Are you ready?
I don't know. Okay, let's give it a try.
One of the first things we noticed was that Siddhartha's anxiety disorder extended to her fear of elevators. She wouldn't consider taking one, even though the center's offices were 6 floors up.
Oh my God, I have so much more to go.
The treatment she hopes will cure her is called intensive exposure therapy. Without relying on drugs or traditional psychotherapy, which can take months or even years to prove successful, this new technique asks patients to confront the very things they fear the most, and is said to help many recover within days. Sandra Baker will be Siddhartha's therapist.
Well, I'm not going to talk her out of the fear. I'm going to ask her to experience it to the fullest so that she can learn that she can have this anxiety and her worst fear doesn't come true.
The treatment is based on the success psychologists have already had using intensive exposure therapy with people who have specific phobias, such as claustrophobia, fear of heights, or fear of flying. It's also been successful for people who have a fear of spiders, arachnophobia.
I know this is difficult because up till now you've basically tried to avoid spiders. You've gone out of your way.
The idea behind intensive exposure therapy is to have the patient repeatedly confront their fear in a controlled setting. Because all phobias are reinforced by avoiding a dreaded situation, each exposure to it actually lessens the anxiety, and the treatment can be done in as little as a few hours.
It's a lot less threatening than I expected.
It sounds so unreal, so fantastic, that something you've had all your life, possibly you could get rid of in one day. And yet, we can do it.
The question now facing Siddhartha Jackson is whether the same approach can be used to treat her panic disorder and agoraphobia, a much more complex anxiety disorder.
If you had your dreams, what would you want out of this experience?
My life. I want my life back.
Having finally come to a place where help is available, Siddhartha Jackson wonders, will this new therapy work for her?
In a moment, a young woman confronts her worst nightmare.
I'm afraid. I'm so scared.
And takes a leap of faith to heal herself. When 2020 continues.
You live